Hi, I'm Dr. Rhonda Lowe, and welcome to your Medical Pipeline. In this segment, we're going to talk about how old is too old to get pregnant. With career opportunities and more effective forms of birth control than ever, women have the ability to delay childbearing. And that's exactly what many are doing. In fact, according to Stats Can, there are now more first-time mothers in this country who are in their 30s than there are in their early 20s. But how long is too long to delay having a baby? Well, the bottom line is still, the earlier you start, the better the chances of getting pregnant. But if you have the luxury of planning when you want to give birth, pick sooner rather than later, especially if you would like more than one child. That's because there really still is a biological clock. As a woman ages, her eggs begin to die off, and fertility actually starts to decrease in your 30s. It starts to creep downwards after the age of 35, but it really plummets after the age of 40. Each month, a 30-year-old woman has a 22% chance of conceiving a baby. A 40-year-old, only an 8% chance of conceiving. And at 50, women have less than a 1% chance. And while many women now are healthier than ever in their 30s and 40s, well, the bad news is that doesn't mean it will have a positive impact on their fertility. The bottom line is, it doesn't matter if you're in great physical shape because it has no impact on the quality of a woman's eggs. And even if your mom was able to have a baby late in life, it doesn't mean it will happen to you. Unfortunately, there's no way of telling whether your eggs are too old. Although in vitro fertilization has helped extend a woman's opportunity to have a baby into her 40s, the technology is still not very successful if you have old eggs. Women who smoke tend to have poorer quality eggs, so it pays to quit smoking now if you want to become pregnant later. Women who have had chemotherapy or radiation treatments may also have fewer or lesser quality eggs. There is a blood test you can do called an FSH test that may tell you if your hormones are up to the challenge of pregnancy, but it still can't tell you about the quality of your eggs. Now, there are a few clues younger women can look for to tell if they might have trouble getting pregnant. If you have irregular periods, it may be more difficult to conceive. If you have a family history of early menopause, you may have fewer eggs overall. And if you have endometriosis or if you have had a sexually transmitted infection in the past, there may be some internal damage and you should be evaluated by a doctor. As a general rule, I tell my patients, if you would definitely like more than one child, you may want to start trying to get pregnant before age 35. For now, if your biological clock is ticking, it's important to be fit, eat a healthy diet, and not smoke. Take good care of yourself because all these things are important in protecting your general health and helping a potential pregnancy go way more smoothly. My comments are for information only and should not be used to replace a visit or the advice of your physician or other healthcare providers.